Scan. Knock, knock. Hi, my name is Jenna. I'm your nursing student. Can you please verify your name and date of birth?
Rose French, 09-2905.
I'm going to check your wristband. Hand hygiene. Provide privacy. Do you have any allergies?
Gentamicin.
Okay. I don't think you need to wear gloves or PPE. Today your provider ordered a musculoskeletal and integumentary assessment. So I'm just going to be inspecting and palpating and making sure everything feels normal. Do you have any concerns?
Nope.
Alright. First I'm going to gather and cleanse my equipment. My necessary equipment today is my watch. Are you going to come to a position?
Yep.
Okay, we're going to go on to the skin assessment now. I'm just going to ask you 3 questions. Do you have any bruises, lesions, or scarring?
No.
Okay. Do you have any moles?
No.
And do you see a dermatologist regularly?
No.
Okay. Good. Now I'm going to inspect your skin. I'm just looking for color. Bless you. Color's tan and good.
Okay.
Next, I'm going to check your buccal mucosa. If you can open your cheeks, good. And then your tongue and your conjunctivas, good. So color and moisture is normal for those. Next, I'm going to inspect your skin for any bruises, lesions, or rashes. None of that's present. And then next, I'm going to look at your fingers and toes for contour, color, and shape. Good, no signs of clubbing. And then I'm going to verbalize the ABCDE scale: A, asymmetrical; B, border; C, color; D, diameter; E, evolving. And then next I'm going to palpate for temperature, texture, and turgor. Temperature is good, warm. Turgor to assess if you're hydrated. Looks like you are. And the texture is moisturized. Good. And then, so that's all for the skin assessment. Next, we're going to move on to the musculoskeletal assessment. I'm just going to ask you 3 questions. Are you having any muscle pain?
Nope.
Have you ever broken a bone?
Nope.
And how active are you?
I'm going walks every day.
Good. Alright, so you can get your socks on. Turn this a little bit. So when you stand up, I'm just looking for your anterior posture, which is good. Have you turn around? I'm looking for scoliosis, lordosis, and kyphosis. No signs of that. And then I'm going to have you, we're going to check balance. I'm going to have you walk toe to heel. Good. And then walk backwards, doing the same. Good. Balance is good there. Now I'm going to test your balance again. Hands at your side, feet together, with your eyes open for 30 seconds. And then close them for 30 seconds. Here I'm checking the Romberg scale. If she were to lose her balance, it would be a positive Romberg's test. Alright, I'll have you close your eyes. Alright, so your balance is good. Now we're going to check coordination. I'm going to have you do heel to shin, down, both sides, good. And then I'm going to have you close your eyes and do the touch your nose. Good. Next, I'm just going to verbalize the muscle strength scale. 5 is normal, 4 is slightly weak, 5 is normal, 4 is slightly weak, 3 is weak, 2 is poor range of motion, and 1 is severely weak, 0 is paralysis. Now we're going to be inspecting and palpating your muscles and joints. At the end of all of it, I will say the muscle scale of what they were. I will be inspecting and palpating for all of them, and I'm looking for size, symmetry, and strength. So first we're going to do your sternocleidomastoid. If you can turn your head, and then I'll palpate. Good. And then we're going to do your trapezius. Do that. Good. And then your deltoid. Good. And then next we will do the hand grip. So you can grip your hand and then good, they were equal. Then we're gonna do the biceps and triceps. So bicep, tricep, and then bicep, tricep. And then we'll do hip, abduction, adduction, both sides. And then good, and then we'll do your quads and hamstrings if you want to sit on the bed.
Here, let me see.
Yeah. So quads up, hamstrings down, up, down. Good. Alright, so now we're going to move on to your joints. So we're going to do your temporomandibular joint. So if you open your mouth, and then good. And then we will do your cervical spine, so flexion, extension, lateral, rotation. Good. And then good. And then we will do your shoulders, so flexion, extension, abduction, adduction, and then inversion, eversion. Good. And then I will feel all those again. Inversion, eversion. Good. And then next we will do the elbows. So it'll be flexion, extension, supination, pronation. So you do it and then good. And then okay. And then now we will move on to wrists. So flexion, extension, rotation. Good. And then we'll do hands, so just flexion. Good. And then fingers, so straight, and then abduction, adduction. Good. And then move on to hip. So flexion, extension, abduction, adduction, and then rotation. And then both sides. Rotation, good. And then I'm just going to feel. I'll do one at a time. Rotation, good. Extension, good. And then now we'll do knees. So we'll do flexion, extension, flexion, extension. Good. And then next we'll do ankle. So I'll have you sit. So first we'll do flexion, extension, inversion, eversion, and then plantar flexion and dorsiflexion. Good. And then make sure I got everything. Now we're going to do spine, so if you can stand back up. So it's gonna be flexion, extension, side to side lateral, and then rotation. Okay, and then just gonna feel. Good. Alright, so you can lay down and put your shoes back on. That completes our assessment today. Is there anything else I can do? I have time.
Nope.
Okay. I'm going to cleanse and gather my necessary equipment, take out of the room, which is just my watch. I'll make sure the bed is low and locked, side rails are secure, table within reach, collar within reach, and room risk-free of falls. I will do hand hygiene, 5 stages, before patient, after patient, before procedure, touching patient belongings and coming in contact with bodily fluids. I will report any norms per agency policy and document my findings in OneNote. If you don't need anything, thank you for your time.